Excellent. Well, hello everybody, and thanks for joining us for this webinar. The purpose of these series of webinars, 3 of them, is really to inform you all as advocates of infant and young child feeding on developments that have recently taken place at the global level. And I hope that through these webinars we'll also then be able to empower you to support countries to continue to take action both within their own countries as well as at the global level. So I look forward to sharing this with you. As most people really know and recognize of what it takes for optimal infant and young child feeding. From birth to 6 months, it is exclusive breastfeeding. And then from 6 months up until 2 years and beyond, we start with the introduction of complementary feeding, moving towards more family foods, but always with breastfeeding continuing throughout. So the period of 6 months to 2 years is a time of really high nutritional needs, but also frequent childhood illnesses. So it presents a very key opportunity for us to prevent undernutrition. And moves to the complementary feeding, which always is complementary to breastfeeding, so it is together with breastfeeding. We need to make sure that it is nutritionally adequate and safe, because appropriate feeding at this time is central to health, growth, and development. So in the global guidance, it's very clear to us as what both WHO and UNICEF say. You can see that breastfeeding is absolutely the foundation during this time. If they cannot be breastfed, the global recommendation is to use infant formula, and human milk is not available, then cow's milk is recommended. But of course, it is always on the basis that breastfeeding and breast milk is best. And concern, the promotion of breast milk substitutes and commercial foods for infants and young children is in fact undermining the progress that's been made in optimal infant and young child feeding. And we cannot neglect that and forget that. Results, we see that we have various instruments to make sure that we look after and support, protect, and promote breastfeeding. So at the international level, we have, particularly relating to the promotion, a number of resolutions that come from the World Health Assembly. And so I attended last week's session by David Clark, where we got an introduction to the code. You must remember that subsequent to the code, there have been a number of resolutions, and now includes a resolution that was passed last year and that we will be talking about. We also have international instruments regulating the composition of these kinds of products. This is where the Codex Alimentarius comes in, and you will see that there are 5 different standards at the moment for infants and young children. And the one I'm going to talk about today will be this follow-up formula revision that is taking place. Look at the code and the resolutions. The foundation for all of this is the code. That is our number one place that we turn to really look at the global advice around the marketing and promotion and other issues relating to breast milk substitutes. There have also been a number of subsequent relevant resolutions passed by the World Health Assembly. These resolutions have often been passed because there has been a need to strengthen or clarify provisions of the code, or continually to close loopholes as the industry continues to develop new products and new names for products How do we make sure that we continue to address those? And also, as we start seeing emerging marketing tactics taking place, they also need to be addressed. So to remember, all these subsequent resolutions have the same status as the code. They're part of the code, and they must be seen as one and read as one. So you often have particular countries or companies who will only refer to certain provisions or just to the code, where in fact the whole lot must be read together. Going into a little bit around the code, and we first look at some of the points that are in the preamble of the code, we see that the code recognizes that there is a need for infant formula when mothers don't breastfeed. And this is important. It basically states that these products should not be marketed or distributed in ways that may interfere with the protection and promotion of breastfeeding. And in last week's session, David certainly gave a number of examples of where this is violated. The preamble recognizes that improper practices in marketing of these breast milk substitutes and related products contribute to public health problems. This is not in place, the code, just because it's a nice to have or because someone felt it was a good idea. It is because we have to address the very real issues of optimal infant and young child feeding and health. And proper practices can certainly and do negatively impact on health of infants and young children. And the element that I've captured here is that it is very clear that products and a lot of complementary foods should not be used as breast milk substitutes. And the complementary foods we're going to deal with in the next week's set of seminars. So today we're going to be focusing on these other breast milk substitutes. See as a result of this that without doubt, it recognizes the marketing of breast milk substitutes requires special treatment. Need to be treated differently from other products. And for any usual marketing practices that are used by companies for products that are not breast milk substitutes are totally unsuitable for these products. Products need very special marketing rules. I do apologize for the noise in the background. I am at an airport, but I've tried to be in the quietest room. The code then very clearly terms that governments take action to their social and legislative framework and overall development objectives give effect to the principles and the aims of the code. So governments really focus now on the first 1,000 days, on scaling up interventions at this time. They absolutely are imperatively called by the code to take action in terms of legislation, regulation, and other suitable methods. On the code and look at the scope that is defined of what this code covers, you see clearly that the scope covers in formula, but also other milk products, foods and beverages, when are marketed or otherwise recommended as being suitable for use as a partial or total replacement for breast milk, as well as then also covering bottles and teats. So it is very clear when you look at the scope that is not just for infant formula. There's all other milk products that are marketed as suitable as partial or total breast milk supplement and replacement. So breast milk substitute means the code has a clear definition. It means any food being marketed or otherwise represented as a partial or total replacement for breast milk, or not, it is suitable for that purpose. So it is very clear that the code is broad and broader than what a lot of people and certainly a lot of companies would like us to believe. Two products, these are both without doubt breast milk substitutes. On the left with the number 2 is called a follow-on formula, and one on the right is called growing up milk, and these products are marketed and promoted as replacements for breast milk, and therefore they clearly fall under the code. Recently, we had to have a re-look at a number of things and issues. Well, the evidence is very clear, and also there has been growing advocacy once again to really place infant and young child feeding at the center of a number of countries' nutrition action plans. And in the evidence, this is what we see that is a very sad figure. The estimated costs of not breastfeeding come to $300 billion annually. That's a significant amount in anyone's sums and calculations. We also see that in 2014, the breast milk substitute sales were put at close to $45 billion, expected to grow and by 2019 be closer to $70 billion. This shows the industry's large and competitive claim on infant feeding. In many ways, the fact that infant feeding is now so high on the global agenda has provided the industry with a number of opportunities to really try and promote their products. This has to be dealt with. Because by 2019, the market is expected to grow. And important to all of us on this call, I believe, is the greatest market growth of these breast milk substitutes is in the low and middle income countries, where we are working and where we are trying to protect, promote, and support breastfeeding. 1/3 of that global spend in 2013 was actually on these growing up milks, and that formed the largest category. Evidence shows that others exposed to the promotion of breast milk substitutes are more likely to use formula than those that are not exposed to breast milk substitutes. And that is a very important fact. In 2013, the World Health Organization stated that they, meaning follow-up formulas and growing up milk, are in fact a potential risk. It's not only that they are needed and that we want to promote breastfeeding, but they actually potentially are a risk. And we see it's not that this is a new story. In 1986, a region of the World Health Assembly declared follow-up formula and growing up milk as necessary. In 2010, we had another resolution that clearly showed how this continued promotion of these products were undermining optimal infant and young child feeding. Code was called upon to be deal with it. In 2010, another important resolution was passed. Inappropriate promotion of food for infants and young children, nutrition claims should not be made. As this resolution in 2012, the Director General was requested in another resolution that they provided clarification and guidance on what constituted inappropriate promotion for infants and young children. When they started being again a big move. You also know that the World Health Assembly adopted WHO comprehensive implementation strategy on maternal, infant, and young child nutrition. Another important development. 2016, after a lot of work, a resolution was passed. A resolution has a number of points, and I've just pulled out some of them. The first one is the resolution says that Codex, and remember that tends to be the international instrument for looking at labeling and composition issues, should give full consideration to WHO guidance and recommendations, including the code and all these subsequent resolutions. Also welcomed with appreciation the guidance that the WHO had put together on ending the inappropriate promotion of foods for infants and young children. Once again called on member states to implement the guidance and all manufacturers and distributors of food for infants and young children to ensure that they ended all forms of inappropriate promotion. These words in Resolution 69.9 that was passed at the World Health Assembly last year. See this, ask the question. WHO guidance on ending the inappropriate promotion of foods for infants and young children. Well, guidance is really important because firstly, it clarifies and very explicitly states that follow-up formula and growing up milks are breast milk substitutes. They fall under the code and they therefore may not be promoted. So anyone ever felt they weren't under the code, which I've showed you and David showed you was not ever the case, it is now clearly explicit yet again. And is it also provides valuable guidance on ending inappropriate promotion of foods for children from 6 to 36 months. Therefore, the guidance provides a much-needed and positive step forward supporting optimal infant and child feeding and also improving the lives of millions and particularly also saving lives of children. The purpose of the guidance, as stated in the guidance itself, is to promote, protect and support breastfeeding, deal with obesity and NCDs and to promote healthy diets, and importantly, to ensure that caregivers receive clear and accurate information on feeding. I want to say that you see at the top it is marketing of food. I do want to say when we talk food, are always equal to food and beverages. That this covers the period of 6 to 36 months. Some of you might ask, why 36 months? Well, a couple of reasons. See, UNICEF has a definition of a young child that finds it up to this age. Secondly, the guidelines on formulated complementary foods for infants and young children also go up to the age of 36 months. And never forget that the recommendation is that breastfeeding should continue to 2 years and beyond. The promotion and protection of breastfeeding is essential even beyond that 2-year period. So of these recommendations, we see that they apply to all commercially produced foods that are marketed for infants and young children. Importantly, they apply to the promotion of foods through government programs, non-profit organizations, and private enterprises. The exclusion of not applying to vitamin and mineral supplements, home fortification products. Also be clearly stated that these recommendations support the emphasis on the use of suitable, nutrient-rich, home-prepared, and locally available foods that are prepared and fit safely to children. That is always the basis when with these recommendations. This is not saying that these commercial products are better than. We support the emphasis on suitable, nutrient-rich, home-prepared and locally available foods. When it's easy for us to talk about words like marketing and promotion, let's see what this guidance defines them as being. See that marketing is any product promotion, distributing, selling, advertising, public relations, information services. And promotion is interpreted to include the communications of messages designed to persuade or encourage the purchase or consumption of a product or raise awareness of a brand. So you see that when we're talking about what this guidance is, it is extensive and it is broad and it covers, we believe, most of the areas that are often used by the product producers and promoters. I said tonight that this guidance has 10 recommendations. And one I want to just highlight shows that the guidance is very much based on international best guidance we have available, including the guiding principles for the complementary feeding of the breastfed child, as well as the guiding principles for feeding non-breast child. And then we're supporting local food. Recommendation is that function as breast milk substitutes should not be promoted. And I'm going to remind you of what a breast milk substitute is. It's milk, or could be used to replace milk in a fortified soil that is appears in either its liquid or powdered form. And these milks are specifically marketed for feeding infants and children up to the age of 3 years. So note that this is not all milks that are covered by this. These are only milks that are marketed for feeding to children under 36 months, because they ipso facto replace or displace breast milk. The code covers all products. If you have a look here, you will see here's an example of 3 products. On the left is what would be called an infant formula. It's what would be called a follow-up formula. And on the right is what would be called a growing milk. All products are breast milk substitutes. And the research also clearly shows mothers and caregivers do understand the distinction between milk promoted for different ages. It's important that even if companies tell us that 1, 2, and 3 are different, mothers and caregivers don't notice that difference. And that is important to remember. Now I've shared with you how this guidance links to the follow-up formulas and growing up milk. Next week we will look at how they link to the broad range of complementary foods. I want to ask now, is this even mean to countries? And the first thing it means for countries need to update and strengthen their policies and their regulations. They need to make the code law if ready. And need to ensure that all the necessary products are included in their regulations. So countries, this means they need to extend their regulations to include any milk marked being suitable for a child up to 36 months. no matter what they're called. Infant formula will fall under that, follow-up formula, growing up milk, toddler milks. All of these need to be included in the regulation. For countries, that they need to incorporate WHO guidance that I've just talked about to you into national regulations. This, they need to include guidance also on complementary foods. In fact, they actually need to consider all marketing of foods that may impact the double burden. We know that that is increasingly a problem in many countries. At all points, we need to make sure that mothers and caregivers are provided with clear and accurate information on feeding infants and young children that does not contain any marketing promotion or result in any conflict of information and in provide. Second thing it means for countries need to engage in this alimentarian review of the follow-up formula standard. I mentioned it at the beginning to all of you that we have not only the code, but we also have coding. And we need countries, as much as they need to implement the code and all the subsequent resolutions and the new guidance in their national legislation, they also need to be active at the global level with discussion that's happening on follow-up formula and the review of the standards. So maybe for some of you, you might not have heard Codex before or not know very much about it. So this slide is just to introduce you to Codex, joint body of both the World Health Organization and the FAO. It is a collection of internationally recognized standards, codes of practice, guidelines, and recommendations. What is important is that these Codex standards are often used by countries in their regulations, referred to when their own standards. This Codex is hugely important. The sad reality that we find at Codex, particularly with developing countries and our low and middle income countries, is often the meetings are not attended by these countries. Few countries will miss. Many will actually miss a Codex meeting. And I'm just going to at this point just ask that everyone checks that their microphones are muted, please. Picking up some background traffic noise. So let's go back to Codex. Often the meetings are not attended, or they're attended very erratically, or they're attended by people from the Bureau of Standards who have no understanding of infant and young child feeding or nutrition, or attended by individuals who haven't been briefed on the issues, or they don't know the subjects and associated issues. They might not know what the country's view on infant and young child feeding is. And we've even found, including at last year's meeting, the Codex meetings are sometimes even attended by the private sector as representative of that country. Now, I understand all of those are exceptionally problematic. As when we see that Codex could this opportunity of revising the follow-up formula standard to meet its mandate to be agreed in a World Health Assembly resolution, that the code and relevant Health Assembly resolutions into consideration when its standards and guidelines. This means that it absolutely, a joint body of the WHO and FAO, you would think Codex would ensure alignment with WHO, SAO policies and guidelines. But the reality is that doesn't always happen. And we need to make sure that in this revision of the follow-up formula standard, this does happen. The review of this follow-up formula standard has been in place for a number of years, and then put on the agenda that it required a review. A number of organizations and groups and countries that follow the standard could actually that no need for the standard because children from 6 to 12 months could use infant formula. Children from 12 to 36 months could have milk. However, there were others that were of the opinion that as these products won't go away, a standard is necessary to ensure and to make sure that have been included as a substitute. The reality is that the second option was chosen. So at this point it is unlikely that the will go away. And therefore we must engage to make the best possible standard to protect our health. Their microphones are muted, please.
I'm sorry if I interrupt, Jane. I think whoever is joining over the telephone, I cannot mute you, so please mute yourself, mute telephone, or wait. Thank you. If not, we'll have to expel.
The follow-up formula standard, I want to make it clear that this standard is looking at both the composition and the labeling of these products. Important, and new maybe for some of you, is that this standard for follow-up formula is going to have potentially two categories. One, older infants, address 6 to 12 month period, and of a follow-up formula for young children, looking at the 12 to 36 month category. So I think you will all agree this review and revision could have a profound impact on infant and young child nutrition and health, and therefore, as promoters and supporters of breastfeeding, appropriate infant and young child feeding, we need to be engaged and need to be advocating at the country level for countries to engage. Because at Codex, at the World Health Assembly, decisions are made by countries. There are three critical issues for Codex coming up this year in December. The first one is to do with alignment, and we'll talk to each one a little bit more. The one is that names and definitions are going to be critical. We have strong belief that follow-up formula for children aged 12 to 36 months should not even be called formula. And thirdly, that all products included in the standard must be defined as breast milk substitutes, fall under the code. And this needs to be made clear and explicit. Let's start with the first one that I mentioned, which is about alignment. Relations between Codex documents and solutions made at the World Health Assembly. Oh, the World Health Assembly is the world's highest authority for health policy setting. 69.9 was passed last year by the World Health Assembly. Therefore, it would be absolutely ludicrous if Codex did not follow that resolution stated. Code standards should be supporting priorities identified by member states And know that member states have all stressed that optimal infant and young child feeding is important to them. Therefore, we know that many countries are recognizing the importance of the code and subsequent solutions. So we need to make sure that these are also covered in Codex standards to support priority areas of member states. And we also believe that the work of both bodies, the World Health Assembly and Codex, and the work of FAO and WHO must all be mutually reinforced. So this review alignment is critical. At Codex for that alignment. First, the developing must make specific and direct reference to all relevant World Health Assembly resolutions, including 69.9. The scope text, which we're talking about now, must also be clear as to the products covered to ensure no loopholes are created. It was important that Codex was names and definitions. And you might ask, what's in a name? We learned at Codex a great deal. And the price for older infants, the 6 to 12 month category, is relatively easy. And it's like the name for this will be follow-up formula. For the young children category, the 12 to 36 month category, is a problem product. Because children, in fact, could just have milk. So the word formula is potentially problematic. Or we certainly don't want any names that glamorize these products or in any way make them seem to be particularly important and special. So on this slide, I'm showing you the current set of names for them that are up for discussion at the moment. See that there's potential name to be formulated, milk, or placed drink for young children, or use it as a formulated milk-based or plant-based beverage for young children, or call it a supplementary milk-based or plant-based drink for children. See, you can work your way through the different options that could be utilized and that are under discussion and on the table at the moment. Certainly, our current preference as Helen Keller International, based on the options, would be a young child milk-based or plant-based drink. But absolutely open to suggestions. And if any of you on this call can really think around it and make more suggestions that would say what it is without glamorizing it or making it look like something important or special for children, we would most welcome to hear from you as to what you would think of. What is required at Codex regarding what I've said, names and definitions? Well, definitions of both of the products in the standard, the 6 to 12 and the 12 to 36 months, must make specific and direct reference to them being breast milk substitutes. There's some examples of the text that's been looked at. So some discussion that the formula for older infants means a product specially manufactured for use as a substitute for breast milk, as part of diet for older infants when complementary feeding is introduced. At least with that option, it is clearly defined as a breast milk substitute. Another one, once we have the name of this product that I've just explained to you is still up for grabs, whatever name would be defined as this product for young children means a product specially manufactured for use as a substitute for breast milk, helping to meet the normal nutritional requirements of children as part of the progressively diversified diet. What to say to you here is that these names are still for discussion. They appear in square brackets. It means they are not finalized. And certainly know that we are going to have a battle with the industry who have a loud body and a loud voice. I say to you, they even sometimes attend Codex as official country delegates who do not want the breast milk substitute to be included actually in the definition. So I think that follow-up formula is without doubt a breast milk substitute. Breast climbs substantially when follow-up formula is consumed by older infants and young children. This against the global recommendations of continued breastfeeding to 2 years and beyond. Some of follow-up formulas and standard undermines continued breastfeeding. Also know that follow-up formula is often promoted with labels that look very similar to infant formula. We call this cross-promotion. Of follow-up formula undermines breastfeeding, contributes to the misuse of these products, and contributes to increased health risks, and even contributes to the greater consumption of infant formula. Is required at Codex. The labeling section of this text must do a number of things. It explicitly states that the act should not discourage breastfeeding. Its statements supporting exclusive breastfeeding for the first 6 months and continued to 2 years and beyond. It will the use of images and endorsements. It allows for these products to make any nutrition or health claims, and also not allow for any cross-promotion. I'll give you a perfect example of cross-promotion. You see the 3 categories: the infant formulas, the follow-up for 6 to 12 months, and the follow-up formulas 12 months to 36 months. And you'll see clearly in this picture, how names are the same. Color schemes and designs are very similar. The slogans and mascots hardly differ. And out of this, it is not uncommon that these products don't only promote themselves for being used for those age children, but back-promote subtly but intentionally the infant formulas that are not allowed to be promoted. But until now, many companies have promoted these other 2 categories. No promotion of any of these products should be allowed. Certainly, in the Codex standard, these product formulas should not be allowed to look or be anything like infant formula. More on the research that has clearly been done by Helen Keller International through the ARCH project, Assessment and Research on Child Feeding, you find that a number of articles have been published in this open source available. You can link onto this and download them. That really shows that follow-up formula and growing up milk are labeled similarly to infant formula in low-income and middle-income countries. They are another series of articles that will show you many of the issues that we are talking about. Dave's slide last week, and I just wanted to put as I come to the close on mine as well, is to remember that we really need to make sure that we protect the human rights of infants and young children. It comes to the work that we're doing on follow-up formula and growing up milks, particularly currently at Codex, saying of course, the founder of Helen Keller International is true. We can do so little, so we can do so much. And our request is that we really try and get civil society organizations to engage governments at the national level, one, to carry out their responsibility in terms of their own national legislation and regulations and situations, two, to truly engage at the Codex level so we can make sure that Codex does what it needs to do with infant and young child feeding. With that, I thank you, and we begin looking at the questions.
Wonderful, Jane. Thank you very much. Really interesting and rich discussion, rich presentation. And for everyone, we are recording, and the slides as well. The audio will be shared in a couple of weeks. I have a couple of interesting questions. Perhaps we can start from what we have here. Let me see. Maybe I want to open your microphone. You want to share your question with us? Yes. If not, I can. So you say that the caregivers and mothers do not know the differences when it comes to infant formula, follow-up formula. Where can I find sources or stop the info? And
Thank you, Agatha. There is some very interesting research that has been done by this in a number of countries. And so what I will make sure that I do is I will, before we circulate these slides, I will add where you can find the research. Those articles are all referred to as well in the ARCH study that I've shown you on the slide. So if you link to that study, you will find the other research that shows that mothers in many countries don't distinguish between infant formula, follow-up and growing up milk. So they are links in our study to the other study, but I can also directly give you the information.
Wonderful, thank you. I have a question from Diane, and she's asking what can be done to prevent the private sector to intervene what is regulated by the Codex.
Yes, lovely to hear that you're on the call. So really what needs to be done is that ultimately the private sector involvement in the Codex Alimentarius meetings needs to be really considered. The problem is that what the Codex currently has is they have a number of observer organizations where many of them are private sector organizations that are meant to only be observers. In other words, the discussion and the decisions should be made by the countries. The observers get a chance to give an input on comments, but they shouldn't be the deciding factor. However, as I mentioned to you, the real problem we've seen is a number of country governments actually allow private sector delegates to sit in their country delegations and even to take the microphone on behalf of the country. So that also needs to be considered. Countries themselves should not be encouraged to be taking private sector members to the Codex meetings as part of their official delegation. And secondly, the whole issue of the private sector's involvement in these kind of debates and discussions is something that is an ongoing discussion and needs to be considered.
Yeah. An interesting question from Jenny from Australia, and he says, in Australia we are currently reviewing infant formula products for special dietary use, Example for colic, constipation. There is a little scientific basis for this product. Up here, the WHO code applies. These are heavily marketed to health professionals and directly to the public. Research concerning mothers currently breastfeeding that are displaying normal feed behavior shows to change the specialized formula in the mistaken belief that it will be better for their baby than breastfeeding. So how can we address this?
Well, absolutely, and all of these special formulas and these formulas that they call for special medical purposes all still fall under this code. And that is why there's been a lot of hard work for resolutions that I've showed you earlier in the presentation to say that none of these products are allowed to make nutrition and health claims. But you are quite right that firstly, the evidence is usually found to be exceptionally lacking, if in existence at all, that these products deliver on what they're claiming. And exactly as you said, they immediately undermine a mother's confidence in her own breast milk. These products, without doubt, fall under the code, fall under the resolutions we're talking about, and these products should then not be marketed. Of course, the problem is that the code needs to be adopted or taken into consideration in national law to actually have effect. So in Australia, the question would be, I don't know the answer, so Janie, you would know better, is if the code is in place in Australia, this should not be allowed because of violation. So therefore, if it is not the case, it really is important that these products are then considered and are brought to be controlled. It doesn't mean that some of these specialized products can exist. We're not saying these products can't exist. They cannot be promoted or marketed. And that's a very big difference. The promotion of these products with these little scientific evidence for colic or to help your baby sleep better are absolutely just marketing ploys. It doesn't mean that there might not be products available on the market for children that have a very serious health issue, but they never be promoted.
Yeah, absolutely. One more brief question. Agatha says, how about galactose? They fall on the scope.
I'm afraid I'm going to have to say that I don't know the product that you're talking about.
Yeah. One more question, perhaps we can also help in explaining a little bit the concept to BCL. And he asked if a giant doctor has been invited by the formula company to speak topic on birth, but on the back board, it's a logo of the company. Are you breaking the code? I guess more about you are invited to present and you.
Very clear, and I hope I'm giving you what you wanted. We are very clear that conflict of interest has to be avoided not only in terms of the hospitals and the units where children are and where they gather, but also by us as health professionals. And therefore, as health professionals, and if you read this latest WHO guidance, there is a very important section, and I will touch on it next week, around conflict of interest. So to me, although it says scientific information may be presented, certainly, all marketing that goes along with it, all the logos on the backboard should not be there, and there'd even be a question as whether as health professionals we should be involved and engaged in this kind of presentation.
Yeah, that will be extremely interesting to listen about it. Also, next webinar, and the conflict of interest is one of the main and raising questions, and how to go about it, and how to really don't find ourselves in tricky situation. We are still trying to engage and establish dialogue, but how do we do it correctly? I had a question about penalties, where this law, this enforcement has been recognized and taken up by government. Example of penalties that are really applied. Is it some example you can share about it, where, or is it really more like social lobby, putting pressure, but not real penalties are to companies?
Thank you for the question. And I think this was also raised in the last webinar. We have two issues. Regulations are one thing, and they're only one side of the story. But enforcement and monitoring of those regulations is another issue. And unfortunately, in many of the low and middle income countries, enforcement is where they are exceptionally weak. I have an example of my own country, South Africa, where regulations are exceptionally tight, but the enforcement is very poor. And that's often because they don't have enough capacity, the people that enforce don't have enough knowledge, and this is exactly where civil society comes in to play a role. Because this is where enforcement, and David discussed this last webinar as well, can really be by naming and shaming for civil society to stand up and take action, to writing to companies, by stopping very high-level people at various organizations about these kind of violations. It's probably one of the best ways that we see it. Indeed, regulations is one thing, enforcement is another, and for protection of infant and young child feeding, we need both. And civil society has a very important role to play in both sides of that regulation setting and enforcement.
Very much. I think our time is almost over, and this presentation was absolutely interesting and perfect, let's say, entry point for the next one that will be about complementary food. Also is absolutely tricky aspects of regulation. Absolutely naming and shaming. So this it's been a really interesting to understand. It's key to understand the diverse elements of the regulation, so we can really share and build on awareness, sensitization to whoever is really keen, and wherever organizations and private sector, government are not even keen, we can go further in lobbying together. I would close here this really interesting webinar, unless we have more questions. But I think we will find ourselves then again for the next webinar that will be on the 15th of August, this same time, and what implication for complementary food, as I said before. James, how to thank you? It's been really enriching and interesting, and we could go forever. I think you have a flight to catch.
Say thank you all of you for participating. I know you had to listen for a long time. I have on the chat box also put my email address if anyone would like to ask me further questions. I can't promise I know all the answers, but I hopefully know people that I get them for you from. And also then to just say, I see there is a question about receiving the presentation, and I do know, but I'll leave it to Cecilia to confirm, the presentations will all be made available to you.
Absolutely. Everything will be available as well with the recording. So the recording might take a little more days. We have to transform and upload it on the platform, and we'll share the presentations. And thank you for email. I'm sure people will write to you, but still we will also have the pleasure to have you online very soon again. So we'll come to our exchanges and we can digest all this information and come back with even more questions and our experiences from our context. Thank you much. Thank you, Jane. Have a safe flight. And thank you, everyone, for your participation. And we'll talk to you soon on the 15th of August. So see you soon.
Jai Hind. मिक्स कर दिया शिवांगी 15 मिनट पहले मुझे इवन लिंक भी बताओ
That's